All right, today we're jumping into what feels like a real medical detective story. We're going to explore a truly baffling connection where the health of your liver can literally take control of your mind. This is the brain-liver mystery of hepatic encephalopathy.
Just think about this for a second. What if your thoughts, your mood, your entire personality could be hijacked? Not by something wrong with your brain, but by another organ entirely. Sounds like something out of a sci-fi movie, right? But it's the strange reality of the condition we're looking at today.
So what exactly is hepatic encephalopathy, or HE for short? At its heart, it's a brain syndrome, a whole collection of neuropsychiatric problems that, and this is key, is potentially reversible. But here's the twist. The brain isn't the root of the problem. HE is a complication, a direct consequence of a liver that's just not doing its job anymore. Think of it this way. The crime scene is in the brain, but the real culprit? That's the liver. Okay, so let's start our investigation right at that crime scene. What does a hijacked brain actually look and act like? What are the telltale signs that something is seriously wrong?
Now, this chart here, it's not just some dry clinical scale. It really tells the story of how this condition progresses. Doctors use these West Haven criteria to grade how severe it is. And as you can see, it starts out really subtle. Grade 1 might just be, a shorter attention span or getting your days and nights mixed up, but it can escalate, and fast, to obvious personality changes, deep confusion, and all the way up to grade 4, which is a coma. The stakes are incredibly high. And seriously, don't let that term minimal HE fool you. Even at grade 0, where on the surface everything seems fine, special tests can pick up on cognitive issues. And this is not trivial stuff we're talking about. It can affect a person's ability to drive a car safely or to do their job properly. It just goes to show how incredibly sensitive the brain is to what's going on with the liver.
Okay, so we've seen the effects on the brain. We've examined the crime scene. Now it's time to identify our prime suspect. How on earth does a failing liver manage to wreak so much havoc? Well, it all comes down to the ammonia overload story.
The best way to get your head around this is to think of your liver as the body's master detoxification plant. It's working 24/7, filtering your blood, pulling out all the harmful stuff. But what happens when that plant goes offline because of severe liver disease? Well, those toxins have nowhere to go. They just start to build up. And one toxin in particular becomes a huge problem.
And this is the journey of that toxin. Our prime suspect is ammonia. Now, it's naturally produced in your butt when bacteria break down the protein you eat. Normally, no big deal. It just travels to the liver, which quickly converts it into a harmless substance called urea that you get rid of when you pee. But, and this is a big but, if the liver's failing, that ammonia basically gets a free pass. It bypasses the filter, gets into your main bloodstream, and heads straight for the brain, where it crosses the blood-brain barrier and starts causing chaos. But here's the thing. Ammonia rarely works alone. Oh no, it's got a whole crew. Partners in crime, you could say. A brain affected by liver failure becomes way too sensitive to its own off switches, like a neurotransmitter called GABA, which basically slows everything down. Then you have other toxins from the gut that can pile on, and body-wide inflammation can make that blood-brain barrier even leakier, letting more bad guys get in.
So we've got our suspect and its accomplices, but a lot of the time there's a specific event, a trigger, that's needed to push someone from a chronic state into a full-blown acute episode of HE. So let's look at the things that can set this whole process off.
This is pretty much the most wanted list for HE triggers. An infection anywhere in the body can ramp up inflammation and just tip the scales. A bleed in the stomach or intestines, that gives gut bacteria a huge protein feast to turn into ammonia. And believe it or not, even something as common as constipation can be a trigger because it just gives those bacteria more time to do their dirty work. Finding and treating these triggers is a huge part of managing HE.
So how do doctors put all of these clues together? Diagnosing HE is some classic medical detective work. It's about gathering evidence and, just as importantly, ruling out other suspects that can look a lot like it. The diagnosis is, at its heart, clinical. It all starts with a physical exam, whether looking for classic signs like something called asterixis or the liver flap. It's this very specific kind of hand tremor. Then blood tests give them vital clues about how the liver is doing, and of course, ammonia levels. But the final crucial step is exclusion, making absolutely sure it's not a stroke or meningitis or something else entirely before they land on a diagnosis of HE. And this is a really, really important point. While doctors check the ammonia level, a high number is just a clue. It is not a conviction. The level of ammonia in the blood doesn't always line up with how sick the person is. Someone can be in a deep state of confusion with only a slightly high level, and vice versa. The diagnosis really depends on the whole clinical picture, not just one number on a lab report.
All right, mystery solved. Suspect identified. So what now? How do we fight back? Well, the good news is there are some really effective strategies to treat an episode and, just as critically, to stop it from happening again.
The treatment is basically a two-pronged attack aimed squarely at ammonia. On one side, you've got a medication called lactulose. Let's call that the flushing strategy. It's a special kind of sugar that makes the colon more acidic, which traps ammonia in the stool and then helps flush it out of the body. On the other side is rifaximin, which is the disarming strategy. It's an antibiotic that stays in the gut and just reduces the number of those ammonia-making bacteria in the first place. Very often, they're used together.
Okay, let's bust a myth. For a long time, the thinking went something like this. If protein creates ammonia, then the obvious solution is to cut way back on protein in the diet, right? Seemed logical, just starve the problem at its source.
Well, that idea has been completely turned on its head. We've come to the modern truth, which is that people with chronic liver disease are already really prone to muscle wasting, and starving them of protein actually makes everything much worse. So the guideline now is to make sure they get enough protein, about 1.2 to 1.5 grams per kilogram of body weight a day, to keep their muscle mass and their overall strength up. So after a person experiences an episode of HE, the whole game really shifts to preventing another one. The long-term strategy is all about consistency. It means sticking with medications like lactulose or rifaximin, being super vigilant about catching and treating any potential triggers like infections, keeping up with good nutrition, and, of course, having regular check-ins with their doctor.
And that's where we'll leave it. The story of hepatic encephalopathy is just this powerful, kind of wild reminder of how deeply interconnected everything in our bodies really is. It really makes you wonder, doesn't it? If the liver can have this much power over the brain, what other incredible, powerful connections are just sitting there, waiting for us to discover? Something to think about.